So Todd, go ahead and get into your golfing position, and then I want you to go ahead and go to the backswing. So in the backswing, what will happen is you'll get further tensioning and thoracic rotation of this left side. As this pulls, it can pull the rib heads that are all inside here. It can pull them posterior, and the rib heads is connected to the outside process of the thoracic. So you have the thoracic spine, those connect to the rib heads, and those can both become posterior and start to cause a pain and inflammation cascade all along the inside of the scapula there. What's up, everybody? It's Dr. Brett Jones of the Source Chiropractic. Welcome to the Tensegrity Series, where we discover the ideal expression of tension and compression mechanisms within the human body. Today, we're joined by Todd. Say what's up, Todd.
Hey, what's up?
Todd has been with me for the last like 6 months or so, right?
About 6.
And he first started is actually more for a cycling problem, and he's now made the transition from primarily cycling to moving into a lot more golf. So we're going to call him a crossover athlete. But for over 20 years was an elite cyclist, cycling up to 250 miles a week or more, crushing the game. Had a low back issue that brought him in, that was tied to a hamstring issue. That's gotten a lot better. And now, as he's transitioned to golf, we're discovering some new issues. And so what I want to showcase today is what are some common patterns that can happen in a cycling position with tension and compression. For those that are hearing that for the first time, tension is when things are pulling apart. Compression is when things are coming together. And so when we have a good balance or harmony between those two, we'll call it ideal tensegrity. And so that's why we're calling this the Tensegrity Series. So first, let's actually put you in this stool, if you don't mind just sitting here.
Yeah.
And actually gonna face the other way. All right, so let's go into a cycling position, Todd. All right, so typical cycling position, and that's actually not too bad, but even in this position, with the way his arms are, and the fact that his shoulders are shifting forward into an anterior position, Alex, I want you to come right here. What will happen to the scapula, which is right here, also called the shoulder blade sometimes, it starts to stretch and widen. And as that does, it will create a tensioning mechanism with all of the muscles inside those shoulder blades or inside those scapula. So we got tension here, and as you can imagine, if we have tension on the back, where we're gonna be more compressed, so come to the front, often will be the anterior delts into the pec major minor and across the chest. So compression, tension, beautiful. Go ahead and stand up for me. Now, if you don't mind sharing, as you've made your transition to golf, now from a cyclist, what's been the biggest thing that you've been noticing in regards to your symptoms, pain, or expression?
Well, yeah, when I first started golfing, I felt pretty good, but you weren't playing much.
Right,
You know? So
right.
When I ramped it up just a little bit more, when I'm actually getting a little sore, and
Right.
being a cyclist, I'm thinking I can train hard, and the more harder I train, the better I'll get. No, when I put too much stress, meaning just a little extra, didn't feel bad.
Right.
Then all of a sudden,
boom,
I've got these issues, and now I've got.
So where are you experiencing it?
You know, it's really back in my scapula area.
Yep.
And sometimes it's even closer to the spine. It feels like like a rib is coming out.
Yes.
You've actually.
And that's exactly what happens. So stay facing this way. So let me showcase what's happening. So Todd, go ahead and get into your golfing position. And then I want you to go ahead and go to the backswing. So in the backswing, what will happen is you'll get further tensioning and thoracic rotation of this left side. So these muscles all inside the shoulder blade are going to be at higher tension, so more expansion, tensioning here. And then you're going to get a continued shortening here, and then he'll go ahead and go through the swing. Right? All right, beautiful. Now go back to the backswing. Now in this position, when we have the increased muscle tensioning, what is also happening is as that shoulder blade widens, it can pull the ribs. So go back just to standing up. So what I often see, Alex, you want to come this way to the back here. What I often see is if when you get scapular winging or when you get this external movement on the scapula, as this pulls, it can pull the rib heads that are all inside here. It can pull them posterior, and the rib heads is connected to the outside process of the thoracic. So you have the thoracic spine, those connect to the rib heads, and those can both become posterior and start to cause a pain and inflammation cascade all along the inside of the scapula there. So what's happened through time, go back to that cycling position with your arms forward. What's happening through time, as we've created tension, we often lose strength in this area. So go back to straight up, because we don't have strength here, because it's been being tensioned, when he goes to swing, it's just gonna pull this out because the scapula is not stable. So I wanna say this now too. When we have more compression, things coming together, we have more stabilization. When we have more tensile stress or tension, we'll often have more mobility. So he's got some of the mobility, but he doesn't have the compression or the strength, specifically in the rhomboids, to keep the scapula in a good position. And so what happens is he pulls the rib heads out, he pulls the thoracics out, owie. Ow. So let me show you how I would approach this from the chiropractic standpoint. And I want to make sure that you go ahead and stay in this video, because I'm also going to give you some things that you can do at home to help this issue as well. So go ahead and let's lay down here, Todd. And so grateful for Todd coming in today to shoot this video, getting back in the flow here with our new Tensegrity Series. And so initial approach is always going to be similar. We're going to connect to our heart space before connecting to another person, making sure that we're fully present, fully aware. Now, in regards to this specific issue, often what we'll find is a posteriority on the thoracic vertebra and or the rib heads. And so I've been adjusting them throughout this last week, and it's definitely getting better. But as I go ahead and I do my sync here, I would say right here at T4, right around T4 area, we have a rib that is still slightly posterior. And what you'll often find is that it'll be tender. The rib heads have some tender nerve endings right near them. And then also some level of inflammation. Anytime we have any type of bone movement, that bone is going to be connected to fascia, so you'll have fascial distortion. You'll also have muscular derangement. And so I want to see, okay, do we want to adjust that first? I'm also seeing in this position that the scapula, so if I put my hands where the scaps are, he's slightly wider on this side. So I want to make sure before I adjust this that I'm going to get that scapula to come back closer to midline with my setup. And even as I did that, we just got a facet release on that rib head and thoracic junction. But I want to set it deeper. So I'm going to go ahead and do a pre-traction. And what that does is it takes out the excess tension from that shoulder blade going this way, putting it into the ideal position to be adjusted. I'm actually connecting to the rib through my thumb joint right here. So that's going to be my maximal focus there. Take a breath in, Todd. Let it out. I follow it in, I keep the ideal tensegrity, and I send it. Boom. Okay, as you could imagine, if we have a distortion here, there's nothing that happens in isolation. So this is going to affect the rest of the system. So let's check in on what else we're finding. So yes, you start to get this slide down here as well on the mid to low back. So for the second adjustment, I got to figure out what's going on. Well, I got a posterior ilium here. So we call this a PI. So if I palpate the PSIS's, it's going to be slightly rotated back here, and that rotation is causing this slope here, and then we had the scapular tensioning here. So I want to adjust the pelvis, and I'm going to see if that clears up the rib cage. Go ahead and go this side up for me. So I hope you're following along. I know I'm saying a lot of big words, but basically there were some rotations, right, in the spine and in the pelvis that may be compensations to the main issue that he's experiencing in the left scap. But if we don't clear it, this is going to continue to help create what he's been experiencing. So it's important to clear the whole spine. It's one big pattern, not just one isolated segment that has a problem. So we're going to go have the pelvis go here, and we're going to take it through. Perfect. Woo-hoo-hoo. Face down. Big one. I do want to mention this. Often, if the person is experiencing the rib head pain that's higher, like closer to the T3 area, T2 area, it can be posterior atlas because there's a muscle called the levator scap that goes all the way to that area. This is not the case here, but I did want to mention it for those that are following along. Okay, so now this feels a lot better. We have a lot better rib cage symmetry and tensegrity. The scaps are in a better position. Go ahead and rotate to your back. So we also want to check the neck. We check the whole spine and extremities when necessary because, like I said, it's all connected to all. Nothing happens in isolation. One thing goes out, it's going to affect the gait, it can affect the squat, it can affect overall performance. We got to check the whole spine, the whole pattern. So I got C5, C6 On this right side, we're gonna clear. Beautiful. We'll go ahead and check the legs for balance. I like to check an internal and external rotation of the hips. Check the heel tension, will give us some insight too. Check the quad balance, the knees, the calves, all doing solid there. How we doing, Todd?
Feel good.
Beautiful, come on up for me, brother. So that was a solid adjustment. Now, of course, I can say, see you next time, and that's beautiful, right? You got an amazing adjustment. He's gonna be in a better healing position. And if he goes back and does a lot of the same things, opening up real wide without getting the insight of needing to strengthen and or gain mobility of the scapula, because what can happen, go ahead and turn that way for me one more time. What can happen is if you've been in that tensile position for a long time, you can build adhesion even in that tensile position. So one, we gotta clear up the adhesion to gain mobility for the ability for the scapula to come back towards the midline, and we gotta build strength here. Now, a lot of times, you want to face the camera again. A lot of times, my people will discover it for themselves. We're doing these videos to hopefully educate you that when you start to understand tension compression patterns, you're going to start to get real creative in how you can do movement to help really heal your own issues. So I'm going to give you a couple things that I showed Todd that I think are going to be really helpful for right now. One is going to be opening up scapular retraction. So this is gaining the mobility to bring your scapula backwards. And so the ability to bring them back and closer together. So what I'll do is have Todd face that way. And then I want your arms straight out in front of you. And then go ahead and put your thumbs up. Beautiful. And I want you to squeeze your shoulder blades together. So as you see him go through that, there is a little bit of a disconnect or miscoordination, if you will, of the left side coming back. So do that again. That one was a little bit better, but we're seeing that there's a little bit lack of strength right here. Go ahead and go out again and go back. So that was the best one. So the third rep was the best one. If I wanted to increase this, I could have a band so you can use my hands for now. So imagine a big elastic band that he could tie to the end of something, and then he'd get a little resistance, but go ahead and keep your arms straight and bring your shoulder blades together. Boom, using the resistance. So his tendency also is to bring the shoulders up, right? And that's a learned pattern. So this is part of the rewiring process that we have to make some updates to, and that's why I'm telling him to do this exercise in the mirror. Because what he's doing right now, as soon as he goes back, he's elevating his traps are engaging, he's elevating his shoulders, versus something like this, where it's just a back. So first progression is you do that in the air. Second progression could be you could do that against the wall, right? So I'd have my hands against the wall, and then I'd start in a neutral position, and then I would sink in so that my scapula were coming together. And then I would say the third progression would be I'd go into a push-up position, keep a neutral neck, neutral spine, keep your arms straight, and then squeeze your shoulder blades together. So here, be careful of jutting your head forward, and be careful of your lower back doing weird things. So scapula together, scapula apart. The second exercise that I gave Todd is a thoracic opener. So that's gonna help get the scapula back and while training the rhomboids, which is gonna help keep the scapula there. Second exercise we gave is a thoracic rotation. So we're gonna work that, go and face that way, Todd. All right, arms out in front of you, palms, fingertips together, and then go ahead and open up to the right side. Good. And straight. And so this time as you open up to the left, don't rotate your thoracic until your arm goes through the motion. Yes, now bring it through, now open up, squeeze shoulder blades together, boom, back across. So I like ending with the shoulder blade squeeze because it's gonna help work that compression mechanism, right? We're at tension, when we add strength and stability, that's compression. And he's gonna be doing the scapular retraction so that he also has the mobility. So two main exercises that you can do. Well, again, one's working mobility, one's working stability. And I hope you enjoyed this journey. Thank you for joining us for this new Tensegrity series, where we're finding and discovering ideal tension and compression within the human mechanism. Thanks. Boom.